This is Dr. Pawan from Cessna Lifeline Veterinary Clinic. Today we are going to talk about spaying and neutering in our pets. As far as spaying is concerned, this is reproductive sterilization of female dogs or cats. As far as neutering is concerned, this is reproductive sterilization of male dogs or cats. There are advantages and disadvantages of spaying and neutering. Let's start with the advantages first. The complications which can happen because of not neutering and spaying them in early age are: in female dogs or cats, they do have tendency to get mammary tumor or breast cancer, uterine infection or pyometra, ovarian tumor or dominance behavior they do show. Sometimes they have a tendency to run away from the house or can get lost or can undergo accident. As far as male pets are concerned, they do show dominance behavior or territorial marking. They start urinating here and there. Apart from that, they do undergo prostate gland tumor or prostate gland disease, which are quite common in not neutered dogs. We do come across in the male dogs and cats that they run away from the house and get lost and can undergo accident as well. Coming to the disadvantages of spaying and neutering, there are not very serious disadvantages but very important one, that reproductively they are sterile, so you can't mate in the future, so there is no breeding life. Second things, it has been seen that these dogs which has been spayed or neutered, they have more tendency to put on weight. The reason being for that, because 15-20% of the calorie requirement go for the reproductive functions, so animal has a more tendency to put on weight. So this is advised that we should reduce the calorie intake by reducing the diet or maintaining the regular exercise and other things, and apart from that we should maintain a regular weight control for our pets as well. Spaying and neutering is a short and elective surgery which is normally not a very long surgery, and it doesn't take much time as well, and healing and recovery is quite quick. An animal can go back to the feet and feeding and walking and other thing on the same day of surgery. As a pre-operative requirement, we do advise that animals should be in a clinically healthy stage. Animals should be fasted between 4 to 8 or 12 hours depending upon the veterinarian's recommendation or age of the pet actually, and one pre-anesthetic blood work should be done. During the surgery, animal it only has to be on anesthesia for 15 to 20 minutes. It is a small and minor incision and normally it heals quickly. And as a post-operative care, animal can be on rest for 3 to 4 days, and it can be on pain management medications, but there is not any kind of really serious post-operative management required for the spaying and neutering. There are the clients oftenly ask us actually about whether it's ethical to do spaying and neutering. This is more personal question actually, but as far as the nature has given reproductive function or reproductive systems to do regular breeding or mating actually, but on practical ground it is difficult to do regular mating and breeding. If for our pet owners, if it is not practically possible on regular basis, then it is advised that we should go for neutering and spaying actually for our pets.